The vagus nerve is the cranial nerve number 10. It is a mixed nerve, motor, sensory, and parasympathetic. And where does it arise from? That's right, it arises from the medulla and has the most extensive distribution of all of the cranial nerves. And it exits with what nerve? Through the jugular foramen. That's right, it is the ninth, the glossopharyngeal nerve. So remember that the glossopharyngeal nerve and the vagus nerve both exit through the jugular foramen. So the branches of the vagus nerve are the meningeal, auricular, pharyngeal, which is the motor to the pharynx and soft plate, and then the superior laryngeal and the recurrent laryngeal. Regarding the recurrent laryngeal, there is motor and sensory. For motor, all laryngeal muscles except the cricothyroid. So that might be a multiple choice question. All the muscles, the laryngeal muscles for the recurrent laryngeal except, and it's the cricothyroid. For sensory, it's to the larynx and below the vocal cords. So that is for the branch of the which is the recurrent laryngeal. Another branch is the cardiac branch, and then the pulmonary branch. So one clinical correlate for the vagus nerve: one that happens within the skull, and one that happens outside the skull. First, that one that happens outside the skull, although it's rare, injury can lead to paralysis of the soft palate and larynx, hoarseness, and anesthesia of the larynx. So if you hear of hoarseness and paralysis of the soft plate, you would guess it's a vagus nerve. Second, injury within the skull could lead to palpitations of the heart, tachycardia, slowing of respiration, and sensation of suffocation. But in that case, both nerves would need to be cut. Okay, so that is the basics of the vagus nerve. Thank you very much.